Okay, so with all that background on muscle physiology and the leverage systems of the body and those factors that can affect the production and magnitude of muscle strength that our examinee gives us in manual muscle testing, let's now get into some actual procedures involved with muscle testing, and let's do some muscle testing. And now for the balance of this program, we're going to be talking about specific manual muscle tests, and we're going to focus on some upper extremity muscles and some lower extremity muscles. And we'll go into general principles involved with manual muscle testing, regardless of where in the body we're doing our muscle testing. And then we'll pull out some specific muscles and we'll go through exact procedures so that you get an idea of some of the principles of manual muscle testing that you can then apply on your own, regardless of what muscle and where in the body you're going to be testing. And to illustrate the manual muscle tests, we're going to focus on manual muscle testing of nerve root innervated muscles. And due to time constraints, we're going to limit our discussion to muscles that are innervated by the brachial plexus, nerve roots C5 through T1, and we'll go over 5 different manual muscle tests that in this case will involve the upper extremity. And then we're going to go into some manual muscle testing of muscles innervated by peripheral nerves. And due to time constraints here, we're going to limit our discussion to muscles that are innervated by peripheral nerves of the lumbosacral plexus. And we're going to focus our attention on those specific muscle actions that the AMA guides ascribe the greatest importance to. And I alluded to this earlier. Those are the muscle actions of hip abduction, hip extension, knee extension, and ankle plantar flexion. Now, it'd be great to have all the time in the world, but we don't, and so due to time constraints, we're not going to be able to discuss every possible manual muscle test of every possible structure that the AMA guides describe. In fact, we're going to be omitting many manual muscle tests about the head and neck that are innervated by cranial nerves and spinal nerves. We're going to be omitting many of the manual muscle tests in the upper extremity that are described in Chapter 16. Same thing with Chapter 17. However, we're going to go over enough with the 2 sections that we will be doing that you'll understand the procedures that are involved, whether you're going to be involved with testing specific muscles as required by Chapter 15, or whether you'll be testing specific muscles and or specific motions, both of which are required by Chapters 16 and Chapter 17. So what we're going to do is we're going to get deep down into some brass tacks with some procedures involved with actually performing manual muscle testing, and we're going to go through some basic procedures, and I'm going to emphasize the grading systems that the AMA guides uses, and I'm going to try and translate the grading systems into some real world application that might result in positive objective findings that you could observe in the examination of your injured worker. So let's get involved now with some basic procedures with actually performing the maneuvers involved with manual muscle testing. Now, an interesting thing, and I mentioned this earlier, that the AMA guides require manual muscle testing. However, nowhere in the guides is there any specific mention of the technique or methods that we are to use in performing manual muscle testing. So I did quite a bit of research on the various techniques and methods involved with manual muscle testing, and what I'm going to present to you here is sort of a distillation of the commonalities that I found throughout the many references that I researched. And specifically for our purposes here, references that I'm going to refer to include the following textbooks. Number one is the Technique of the Neurologic Examination. That's by DeMeyer. Also, the Fundamentals of Musculoskeletal Assessment Techniques by Palmer and Epler. Those are a group of physical therapists. I'm going to be referring to the 2005 edition of Muscles, Testing and Function with Posture and Pain by Florence Kendall. And then also the Manual on Muscle Testing and Techniques of Manual Examination by Daniels and Worthingham. So what you're going to hear that follows are techniques and references that I pulled out of these definitive textbooks. At least I say that they're definitive in the area of manual muscle testing, and certainly the textbook by Florence Kendall has been around, and Kendall has been around for the better part of 50, 60, and maybe even 70 years reporting on manual muscle testing. So these are all reliable references that you can refer to if you have questions about specific procedures involved with manual muscle testing. Okay, so some basic rules when it comes to performing manual muscle testing. Let's go through these individually. I have about 10 to 12 different rules, 10 to 15 different rules to keep in mind in order to provide results and gradings on your manual muscle testing that are both repeatable and reliable. And they should be repeatable and reliable both by yourself, if you are to come back and test your examinee on several different occasions. You should have repeatable results. And then also another examiner, such as me, if I was to come along and perform manual muscle testing on your examinee, I should be able to come up with a grade of muscle function at least within one grade of your findings. And so in order to ensure the reliability of our results, we need to employ several basic rules. Rule number one, you want to place the subject in a position that offers the best fixation of the body as a whole. Now this will generally be either supine, prone, side lying, and to a lesser extent sometimes standing. Depending upon the body part that you're testing, you want them to be in a position where they're able to fix the untested parts of the body, so that the tested part of the body has a stable fixed structure against which it can pull. Number two, you want to stabilize the part proximal to the tested part, or as in the case of the hand, you want to stabilize the part adjacent to the tested part, and that'll become important when we get to testing the fingers. And stabilization is necessary for specificity in testing, and I'll explain a little bit more about that when we talk about stabilization. Number three, you want to place the part to be tested. Place the part to be tested in precise anti-gravity test position whenever appropriate. This helps to elicit the desired muscle action and to aid in grading, and it helps to prevent the recruitment of muscles unrelated to the muscle that is the one that you're testing. Number four, you want to use test movements in the horizontal plane when testing muscles that are too weak to function against gravity. We want to use test movements in anti-gravity positions for most trunk muscle tests in which body weight offers sufficient resistance. For other muscle groups, we will test in the against gravity position, and most of those will involve movements in the vertical plane. Number 5, we want to apply pressure directly opposite the line of pull of the muscle or the muscle segment being tested, because the direction of pressure helps to elicit the exact desired muscle action, and the exact desired muscle action is recruited by resisting forces directly opposite the line of pull of the muscle or muscle segment being tested. Rule number 6, you want to apply pressure gradually but not too slowly. You want to allow the subject to be able to get set and hold, and this is particularly important in those limbs or segments that we test wherein we as the examiner have great mechanical advantage. And I mentioned earlier that this applies to the majority of the muscles that we will be testing. So apply pressure gradually but not too slowly, and apply uniform pressure over a broad contact area. Avoid localized pressure that could cause discomfort. So generally a broad contact area involves the use of your open palm of your hand, or perhaps when testing the lower extremities it could involve the length of your upper arm and chest as you lean on the examinee's leg, for example. But make sure to use a broad contact area that's comfortable for the examinee. Number 7, use a long lever whenever possible, unless, for example, a long lever might be contraindicated. And the length of the lever is determined by the location where you apply pressure along the lever arm. And you can vary the position along the lever arm as needed to coincide with the strength level of the examinee. Now, better discrimination of strength for purposes of grading is obtained through the use of a long lever, particularly when testing muscles that are very strong. So whenever possible, we want to defer to a long lever. We may use a short lever if the intervening muscles do not provide sufficient fixation for the use of a longer lever. Okay, rule number 9, and this is very important. Select movements for the examinee to resist that would just about match your own strength. For example, when testing your examinee in the upper extremity, you want to select movements that just about match your own arm and hand strength. You want to select movements that are neither too strong for you to possibly overcome, nor too weak for you to be able to judge their resistance. And I'll give some applications for this when we get into the specific test procedures, but just to create a ridiculous example, you would not test your examinee for strength of resisted finger abduction by applying pressure to their fingers with your foot, because the imbalance between the strength of your leg muscles and their hand muscles is such a disparity that it's impossible for you to be able to judge the strength of the hand muscles through your legs, and that's a ridiculous example. But I think you get the point. Number 10, you want to understand that muscles are their strongest when they act from their shortest length, and they have little or no strength when acting from their longest position. So we can use this information. So therefore, to test muscles of weak or even modest strength, start with the position in a muscle in a position of strength. And this is something that will apply to your weaker or smaller examinee, or when testing weaker or smaller muscles. To test very strong muscles, such as those muscles involved with knee extension, for example, you want to place the muscle in a position of disadvantage in order to bring them to within your own range of strength. So for the quadriceps, for example, in order to get a sense of the strength of the quadriceps muscle, we have to place them in a position of length near their longest position, and that would be a position of increasing knee flexion, because the quadriceps become lengthened with increasing knee flexion, and they become shortened with increasing knee extension. So that's an application there of this principle. Rule number 11 is you want to gain cooperation from the examinee, and you want the examinee to give you their best effort. And so you want to engage the examinee and get their competitive spirit into the game of manual muscle testing. Encourage them to put forth their best effort. And sometimes this might require you to repeat the procedure for 2 to 3 to even 4 repetitions. This allows them to get warmed up. This allows them to understand what it is they're doing. This allows them a couple of repetitions to become accustomed to recruiting the appropriate muscle. And you want to encourage them each time to put forth their best effort, because that's what we're after. We're after their very best effort. And sometimes you can't get their very best effort on the first repetition, and even without, sometimes you can't get their best effort without encouraging them to do so. Rule number 12 is to test in a repeatable direction, a repeatable sequence, and that generally flows from superior to inferior, although you may create your own sequence. For example, in the upper extremities, we would test, if we were doing some upper extremity tests and some lower extremity tests in the same person, we might begin in the upper extremity with the deltoid, and then go to the bicep, and then go to the wrist, and then go to the hand. Similarly, in the lower extremity, we would begin at the hip, go to the knee, go to the ankle, and then into the foot, or some sort of repeatable direction that you can develop as a procedure. Generally, it's recommended to test from superior to inferior. And then finally, rule number 13 is always stabilize the proximal joint to prevent muscle substitution. Always stabilize the joint proximal to the joint at which you're testing to prevent muscle substitution. So for example, if we're testing the deltoid muscle, we would stabilize the scapula, because the scapula is proximal to the joint of action of the deltoid muscle, which is the glenohumeral joint. Or in the case of the deltoid, if the scapular stabilizers are strong and they appear to hold, then you might stabilize on the opposite shoulder in order to fixate the entirety of the trunk. If we're testing the biceps, we would stabilize on either the humerus or the scapula. If we were testing ankle inversion using the tibialis anterior muscle, we would stabilize on the tibia. Now, let's talk a little bit about substitution. When muscle weakness exists, other muscles immediately substitute in an attempt to hold a position that resembles the test position, and this creates a visible shift from the test position. And when you see a visible shift from the test position, this indicates that a substitution movement is kicking in. And substitution results from one or more of the muscles attempting to compensate for the lack of strength in another group of muscles or another muscle singularly. And substitution is a good indication that the tested muscle is weak. And for accurate muscle examinations, no substitution should be permitted. And I'm thinking of an example of a manual muscle test that I recently did where I detected muscle substitution. And it was a case where my examinee was lying prone, and I was testing hip extension. And so I asked the examinee to maintain a straight and rigid right lower extremity, and to go ahead and lift the extremity from the hip off of the table. And due to hip weakness and hip pain, the examinee substituted pelvic rotation, posterior rotation on the right, to substitute for right hip rotation. And it can create the external appearance of the same type of movement, because right pelvic posterior rotation does raise the right leg from the examining table, much as would hip extension raise the leg from the table, and it appears externally to be the same movement. But that movement is created by substitution, and really the examinee had a lack of right hip extension. But it appeared that there was adequate extension due to substitution. Okay, so there's some basic rules. Specific manual muscle tests for the spine and for the upper and lower extremities are going to be described now in the next section, which we'll get into. And I'll refer back to these basic rules when it comes time to discuss the positionings involved and the stabilizations required for each of the specific manual muscle tests. Before we get into each of the manual muscle tests, let's review the grading of the manual muscle tests and the objective findings that we might see with each of the specific muscle testing grades.